Glad you could join us today. I am Thomas Burnett from the John Templeton Foundation, and I'm pleased that you'll be able to join us for the conversation today with Liz Grant from the University of Edinburgh, where she is Director of the Global Health Academy and Director of the Global Compassion Initiative. Our moderator today is Olga Khazan from The Atlantic, where she, I think, is currently on book leave, so you haven't seen as many stories from her recently, but big thing is coming. We're going to keep this precisely to an hour today so you can get back to your busy lives. So let me tell you how it's going to unfold. Liz and Olga will start off by having a short conversation with each other. Olga's got some questions to kind of prime the conversation, bring up some major themes. But after that 15 minutes is up, the whole rest of the hour, 40 minutes or so, you'll have your opportunity to ask questions of your own, of what interests you the most. So in that sense, we'll lean on you. To help us kind of keep things orderly, we found it's often worked best if you've got a question, just type into the chat that you have a question, or you could type in the chat your question. And Olga will be kind of keeping track of the chat, of the order in which people are bringing to her attention that you've got a question, and keeping that conversation flowing. So I think without any further ado, we're going to record the opening conversation of Liz and Olga for those who couldn't be here today. And then when we get to Q&A, I'll cut that recording off so that it's just informal. You can talk off the record, ask Liz whatever you like, and move there from that. Let me see if there's anything else. Yeah, I think that's it. So I will stop here and hand it over to Olga to start us off with the conversation with Liz.
Hi, everyone. Thanks so much for being here. I guess to kick us off, Liz, tell me about the Global Compassion Initiative and how you define compassion.
Thanks, and it's wonderful to see everybody. So thank you so much for coming to this conversation, and thanks, Olga. So the Global Compassion Initiative is one of the initiatives we're running from University of Edinburgh here in Scotland, where I'm based, in fact, in my office, which is just below the Anatomy Theatre. And if any of you know Edinburgh or followed Edinburgh history, you've got the Burke and Hare murders. You've got, actually, I'm situated in a place where there was a lot of things that probably were very uncompassionate happening back in the day. But the Compassion Initiative, we set it up at the university, recognizing a couple of things. That compassion's almost like a buzzword. It's so many places and so many organizations have compassion in their charter. And we all would like to say, yes, we're compassionate people. I don't think anybody would go, no, I'm really keen to live in a place that's uncompassionate, or that I don't want to be associated with compassion. But yet, this is looking very specifically at universities. Universities can be places which are, unfortunately, quite uncompassionate. And we began to ask ourselves, what's happening? What's happening in universities? And it's very topical, both here in the UK and the States, that 46% of university students are actually have mental health issues. So we set up the initiative to look at both the science of compassion and then the practice of compassion. What does it mean when we talk about compassion? And if I can very quickly define what I mean, and then I know we'll look at lots of different pieces around it. But what I mean by compassion, I'm actually using a definition that two colleagues from Stanford developed. And it's about noticing suffering, interpreting suffering, feeling into, being empathetic with suffering, and then taking action. Because with compassion, you've got these two words, or two parts of a word, Middle Old English, Middle French, com and passio. Com meaning together, and passio meaning suffering. So if you think of these four parts, noticing, interpreting, feeling into, and taking action, which is actually closing the loop, the absolute key. Compassion is about being alert to the fact that in the world today, there's a lot of suffering, and often we either don't notice it, or if we do, we just pass by it, or even if we notice it and see it, we're a bit stuck about what to do. So it's thinking, how do we bring these together? Thanks.
And why is it important to focus on compassion and global health in particular?
So yes, so alongside thinking about, compassion in a big institution, most of my work for the last 30 odd years, if not longer, has been in global health thinking, global health practice, the policies associated with global health. And on the one hand, you may say, oh yeah, global health, that's where a lot of people try and do good. And actually, there's an expression or an analysis around compassion that I think is really important in this context. And it is if cruelty is the opposite of compassion, the far enemy of compassion, pity is the near enemy of compassion. And I say that because I think, unfortunately, a lot of global health has been dominated by people and by systems that are trying to do good, possibly out of pity. And actually, global health needs to be turned on its head. Global health is really about health being global. Global health is recognizing that in a shared world, we all deserve to be healthy. It's part of our human rights. It's embedded in the human rights decisions, but we're living in a very inequitable and a world where health in many places is missing. So compassion in global health is about recognizing that across the world there are so many people right on our doorstep everywhere where there's suffering, and they're suffering because, if I can relate this very specifically to the Sustainable Development Goals, because there's suffering that lies under every single goal. And while the Sustainable Development Goal 3 is a health goal, health is in each of these goals. In all 17 goals, you find health, and they need to be met for health to be managed and made good across the world and together with us. So that's why compassion I see as playing a central role in global health, and actually helping us to hopefully reform what is a major discipline, but also act differently. So we're acting collectively together, not acting on people or to people.
So what are some examples of ways that compassion is currently ignored in global health, that the global health community is not acting in a compassionate way?
Well, and where do I start? I think the one classic way, which we're all familiar with, the World Health Organization and Dr. Tedros actually called this out. The pandemic showed us that global health mattered. It showed us that health for all and health was global, and the drivers that push disease, the drivers that push ill health are shared globally. And we saw that in the pandemic because the COVID virus just passed through borders. There was no singular one place or one protection. But you had this extraordinary compassion at work. In the one hand, scientists getting together across the world, sharing the resources, sharing knowledge, adding everything they had to try and get a vaccine. And then you saw what I think has been one of the sort of indictments of global health, where communities, when they had access to the vaccine, and it's our governments, to be honest, it's all our governments, didn't share globally. There was a real division, and you had very, very inequitable access around who was able to get vaccinations after they were developed. And that I suppose is one fundamental, very recent example of global global uncompassion, if we can use that word, or frame that word, of compassion gone wrong. But there another area where I think there's a lack of compassion in global health, and particularly around the Sustainable Development Goals, is it's maybe an unintentional lack, is that we become so fixated with the goals, the indicators, the targets, the resources, the tech that we need, the science we need, reporting on them, that we've completely forgotten that the figures we report are actually people. It's just disappeared. So how a lot of my work is just thinking, how do we bring the human face of health and the human face of care and the human face of the Sustainable Development Goals back again, and can compassion help us?
Well, what are the biggest obstacles to compassion in global health? Because I mean, it sounds really nice and like everyone should want to do it. So why isn't it being done?
Yeah, yes. And I get asked that a lot, because in one sense, even as I'm talking here, it does sound so obvious. And you think, well, yes, that would be the most productive way to work. And there's so much science around what it looks like if you embed compassion in a workforce, or you enable a workforce to work compassionately, or you develop the spaces. But I think the obstacles are that if compassion is what motivates us, or if it's a form of connection, a form of being together, there are other motivators, there are other ways of being together which are also very strong, and some are not quite so wholesome. There's the motivators of protectionism, keep yourself to yourself and keep your money to yourself, and make sure you prepare for the future and protect yourself for the future, or protect your community for the future, be protected. There's we live in a world of us and them. It's how we almost, interpret the world, even though we'd like to think we don't. Our systems, our boundaries, our borders, our barriers are all constructed. And those are powerful demotivators for being compassionate, because they stop us expressing compassion. There are also motivators that are not necessarily bad, but they reflect other priorities. And then there are motivators like fear. And again, if I can reflect back on the pandemic, one of the things that was extraordinary, it was in the US, but we saw it so much in the UK, was the most, probably, if I could say, beautiful behaviour, the most extraordinary behaviour of people coming together, of coming out on the roadside to help, of checking in on our neighbours, of buying NHS staff food, of going and buying food for others and giving away things in order that people could survive. And now, I think one of the things that allowed that was that the fear of doing the right thing, or being seen to be acting out of the norm, rather, not so much doing the right thing, the fear of being seen to be acting out of the norm or doing something unusual dissipated in the context of a pandemic that had taken everything out of the norm. And it felt like there was permission to do things differently, to actually do things that showed care. But when there was permission, when the norm changes again, and the norm goes back to what we know, and the rules, regulations, the systems, everything being we're seen as this is how you act, then somehow compassion, it feels like, has been pushed back, and we are back in a rat race of needing to.
Where's my baby?
Work.
Is there another part to science?
Okay, I'm going to come back. Liz, do you want to come back on? Okay. Okay, great. Not sure what that was, actually. Maybe someone's background noise. Okay, so we're going to take questions from the audience in a second, but I have one. So be thinking of your questions and be putting them in the chat. But I have one question in the meantime while everyone is doing that, which is, Liz, you mentioned that you mentioned the vaccine distribution, which is of course very unequal, and I wanted to kind of touch on that because I was wondering if there is a profit or kind of practical imperative to compassion, because I think like what you're going to run into with some of these ideas is if you go to Pfizer and say you should be compassionate and distribute the vaccine equally, they're going to say, well, we developed it in the US with the help of US government grants. And so the US should get the first crack at whatever we develop. And they're not going to see the necessary, corporations and some of these individuals who are players in international development are profit driven. And I'm wondering if there is any kind of financial incentive that intersects with compassion.
Yes, and that's it's a really important area. And there's a number of different I suppose perspectives or lenses on that. And one is, you also look at what happened. The US led with an alternative way to manage how we looked at this vaccine development distribution from Texas, extraordinary sharing. I mean, and saying we're going to actually produce vaccines that are equitably distributed, that we're not going to hold the IP, that we're going to actually look at sharing IP. But and I think we could all learn so much from that. A second part, just even around the vaccines and the holding on to, was that, if I can be blunt, it wasn't actually the big companies that were the ones who were not wanting to share. They did want their like, everyone needs a profit and it needs a return of investment. Actually, a lot of this was public money going in for it was our governments. It was there was more to the vaccine distribution that beyond economy. There was definitely a real sort of a sense of holding. We stockpiled. Every country stockpiled beyond need. So we paid the vaccine companies. We just stockpiled them for fear of what might happen down the road. Even when the message was, look, if you can get all health workers across the globe vaccinated, you probably would do more in stopping the future drive of this pandemic, and therefore the need for multiple vaccines, than holding on and doing it step by step. But there's another big issue, and it was the question of how. But can I come back again about this mix between economy and compassion? Because oddly, the place where I see compassion most demonstrated and advocates for compassion is actually in many of the banks and the global investment companies, which does sound a little bit strange. And that's one of the things that I have begun to realize, that there is an appetite, particularly among the banking and investment community, to potentially do things differently. So we need to be looking at that. Examples, there's many. Mitsubishi Bank, mindful on Wall Street, are really trying to turn a corner around what we do. There's also a whole push around a well-being economy, and saying, in the end of the day, are people in service to the economy, or is the economy in service to people? And a compassionate approach is about putting people at the centre. So a compassionate economy, and we're working at that on that here in Edinburgh with the wonderful Catherine Trayback, a compassionate economy would be in service to people rather than the other way about. And we would be looking at really pre-distributive wealth. How do we ensure that we're setting up systems that actually work, as opposed to having economic systems and then trying to fix them? I hope that makes sense, because I'm conscious the question is, there's so many parts to it.
No, definitely. No, and I'm sure we'll dig into it as we go on. But I wanted to pause here and see if anyone has any questions for Liz.